Now, survivors of this horrible crash are still trying to come to grips with the tragedy, and over the next couple of days, weeks, months, perhaps even years, many of them may suffer with PTSD, post-traumatic stress disorder. So how can we help our loved ones heal? Dr. Judy Kuriansky is a world-renowned clinical psychologist, lecturer, and radio host, and she specializes in emergency mental health services. She's also an adjunct professor of clinical psychology at Columbia University. She is with us this evening. And Judy, it's nice to have you here.
Oh, pleasure. Always to see you, Roseanne.
As we discuss this troubling topic, let's make a little differentiation here between survivor's guilt and PTSD.
Survivor's guilt means it didn't happen to me. Why did it happen to those people? I feel guilty that I lived, they died, or they're in trauma. It's one piece of this bigger issue that you mentioned, post-traumatic stress disorder, that people know a great deal because we've heard about it from Vietnam vets and from all the vets now. But that's a bigger issue. It's not just about being guilty. It means being afraid to get on a train, on a bus, afraid to commute, afraid to sleep, eating problems, all that big package is what post-traumatic stress syndrome is. And not everybody has it. That's for just, a small percentage of people. It's normal.
When do the symptoms
be scared?
When do the symptoms set in, Judy? Right away, or are they delayed?
Well, that's a good question. They can happen instantly. People could not want to get on any kind of train, or they could take years. That's what we have sometimes with people. I've seen them as a psychologist. 10 years later, somebody's having a stress reaction from this. So that's the reality of what happens. But be prepared that people are going to be scared.
Can they be masked too by perhaps drinking more, taking medications, drug abuse?
Well, these are the things that we really worry about because people try to really obliterate those thoughts by doing those kinds of things. Please don't. The most important thing is to be able to express how you feel about it. And to say, I'm scared, I can't eat, I can't sleep, I don't want to get on a train. This could happen. Every time anything jolts, you can get frightened. Mm-hmm. Or not trusting people, that you're putting your life in their hands when you get on a piece of transportation, even when you're driving a car. Be prepared. This is normal. And the most important thing, too, is when a tragedy like this happens, the good part is that the community comes together, but you also can recognize that it can make you be worried about other things in your life. So you get scared about the train that just, went out of control. But we normally can feel out of control in our lives. So be prepared that little things may bother you. You may burn a pot and you may start screaming. Recognize that the reason is that you're stressed in a bigger way, and little things can bother you. I think that's what's really important.
And can anything good emotionally come out of this?
Well, I'm glad you asked that because you mentioned post-traumatic stress disorder. There is also what we call post-traumatic growth, which means when you have a trauma like this, the train disorder, you can say, you know what? Think about the people you love. That's the most important thing. And that what is important to you in your life that you're going to do now. Kiss your kids. Kiss the people who you care about. Make that decision that you're going to do what you said you're going to do because every day is precious. That's post-traumatic growth out of a trauma.
And how do we help them grow, our loved ones, whether adult or children, if they are suffering from this?
Well, I think with kids particularly, you have to recognize that, especially when they're little, they're not going to say things like, I don't want to go on that train, Mommy. They may end up having huge sleeping disorders. They may start fighting with other kids. They may become bullies when they weren't ever bullies before. And you just have to say, you know what? That could be because of what happened. So the most important thing is to spend time with your children. Right before they go to sleep, you give them extra time of your time together. If they're getting on a bus, go with them for at least a long period of time now so that they feel a little more secure.
All right, and kiss them both, adults and children. Kiss them all. Judy, thank you so much. Now you can